This presentation is going to be on hospital readmissions in elderly patients with congestive heart failure. So to introduce this topic a little bit, the population is going to be elderly patients with CHF, and these are going to be patients who are 65 and older. And the purpose is to examine determinants of health and health disparities that affect the hospital readmission rates for this population within 30 days of being discharged. And hospital admission rates for CHF are very high, and it is found that following a first hospitalization due to heart failure, 25% of patients are re-hospitalized within 30 days, and 50% are re-hospitalized within 6 months of their first hospitalization. So this is a problem that needs to be addressed, and this does become very costly for both the patients and the healthcare system. Heart failure is one of the driving conditions for hospital admissions and readmissions, and it's found that the readmission heart failure costs about $1.7 billion annually, or $13,679 per patient. So the cost of heart failure admissions makes healthcare more expensive for patients, and in turn, it makes it also a barrier for low-income patients or patients without insurance. So this poses a problem for advanced practice providers and providers in general, because it highlights a gap in care once patients are discharged from the hospital, and there needs to be better management of CHF so that this problem of rehospitalizations becomes not so much of an issue. To give a little background on this topic, heart failure is the inability of the heart to adequately pump blood throughout the body, which is essential for proper bodily functions. And congestive heart failure is a national population health concern that affects many Americans as well as people worldwide. It's estimated that 23 million people worldwide have heart failure, and half of those with heart failure die within 5 years of being diagnosed. So this is a definite problem, and there are about 1 million new Americans diagnosed with heart failure every single year. And there are many different determinant of health factors that contribute to disparities. Some of these I'm going to talk about include being of a lower socioeconomic class, having a lack of patient education, lack of continuity of care, frailty syndrome, housing and transportation issues, comorbidities, and unhealthy lifestyle choices such as smoking or eating unhealthy or having a sedentary lifestyle. So to discuss a little bit more about socioeconomic class, patients living in locations with increased socioeconomic disadvantage are twice as likely to be readmitted to the hospital than patients who live in areas of higher socioeconomic class. And as patients who are socioeconomically disadvantaged experience poorer access to materials, social and health resources, the likelihood of hospital readmissions is greater than those who are less disadvantaged. And this would make sense, as patients who are of a lower socioeconomic class usually have less income, they have less education, and less access to healthcare in general. So they don't have the same materials to support themselves as people who are of a higher socioeconomic class once they're discharged from the hospital. And this kind of ties into the next thing I'm going to talk about, which is frailty syndrome. And frailty syndrome includes both social and physical aspects. Social aspects include living alone, having limited social supports, and then physical aspects include having a decreased ability to perform activities of daily living, decreased mobility, and having a higher risk of falling. So due to frailty syndrome, an elderly patient may not be able to go to the pharmacy, for example, because they may not have the social support to get them there. So they wouldn't be able to obtain medications and prescriptions that they need. And then even if they are able to get that prescription somehow, they may not be able to take it because they may not know how to even take it because they don't have the support to be able to help them do that. And another study showed a correlation between the social domain of frailty syndrome and the self-care and self-control capabilities of patients. And those who had adequate social support maintained a better diet, they performed regular physical activity, complied with medications, and they were able to recognize symptoms of decompensation better. There are many different interventions that can be applied to help reduce hospital readmission rates, and a lot of these are very practical so they can be implemented into care. The first one is improving discharge education, and one study used a CHF bundle that was created in order to help improve discharge education, and this included a pre- and post-implementation approach to determine the effects of using a heart failure discharge bundle on 30-day readmission rates, and the bundle included a lot of information about the management of CHF. It included frequently asked questions, information about medications, a review of daily monitoring such as weight and sodium intake, nutrition information, signs and symptoms of CHF, and so forth. And it was found that after implementation of this bundle, there was a 29% decrease in hospital readmissions. So it's really important to assess factors that can lead to readmission in all patients and improve that discharge education. Another thing that can be done is following up with calls and follow-up calls that can be used to give reminders about medications, assess symptoms, and just ensure that proper follow-up care is being provided. And then the use of the teach-back method when discharging patients has been proven to be very beneficial. And the main purpose of teach-back education is to confirm and reinforce the patient's comprehension of health-related information. And it has been shown that the use of teach-back method during discharge education was associated with a 45% lower 30-day readmission rate. And then, of course, ensuring that proper education is provided is going to make sure that our patients are not coming back to the hospital as frequently and they can better take care of themselves. And not only is discharge education an important and essential part of discharge, but it's an assessment of the provided education that must also ensue to guarantee patients are leaving with the means to take care of themselves. So education should be coordinated with the patient, but also if family members are present, they should be there and they should be included in that information. And nurses should always check with patients and just make sure that they don't have any further questions and that they assess anything that the patient may need before sending them away. And then to summarize this presentation, of course, clinicians should be properly trained on how to recognize and treat CHF so that they can give that education to their patients and be equipped to manage this condition. And the APRN should take a holistic approach when managing the CHF patient. This includes looking at their lifestyle habits, from level of exercise and smoking to eating patterns, and taking a look at the patient as a whole, examining other comorbidities that they have. And the APRN should help manage these other patient comorbidities as well, because it's found that if comorbidities are in check, CHF exacerbations will also be reduced. The APRN should also ask questions about social risks such as frailty, which can put patients at a higher disadvantage than those with social support, as we discussed, and connect vulnerable patients to services such as social workers or free clinics who can help bridge care after hospital discharge. So if the APRN knows of services that could be provided to the patients that will help them in following up their care, those should be provided as well. And then it's really important that there is contact between all team members like physicians, nurse practitioners, nurses, physical therapists, nutritionists, case managers, and patient family members, because all patients, all the team should be involved in the patient's care, and they should all be on the same page in order to adequately treat the patients and discharge them safely. This slide includes my references, and thank you so much for listening.